Did you know that one simple medical test after 60 could accidentally push you toward unnecessary procedures, lifelong anxiety, or even life threatening complications, all while you believe you're protecting your health? For millions of seniors across America, this isn't a rare mistake. It's happening every single day. The truth is shocking. Some of the most commonly ordered tests for older adults don't prevent disease at all. They create problems, ignite fear, and lead to treatments you never needed. But here's the part no one talks about. While certain tests quietly put your health at risk, others, often overlooked and rarely explained, can actually save your life. They catch hidden threats in your heart, bones, memory, and arteries long before symptoms appear. Tonight, we're pulling back the curtain. You'll discover the 4 tests you should never take after 60, and the 4 that could determine your strength, clarity, and independence for years to come. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Part 1. 4 worst tests after age 60 to avoid. Test number 1. Full body CT scan when you have no symptoms. For many adults over 60, the idea of a full body CT scan feels reassuring, a high-tech way to catch everything early. But for seasoned physicians, especially those who've spent decades treating older Americans, this scan is one of the most troubling tests a senior can take without a clear medical reason. A full-body CT is not a harmless picture. It delivers a dose of radiation far higher than a simple X-ray, and repeated exposure builds up quietly inside the body. Older adults, whose cells repair more slowly with age, are far more vulnerable to the long-term damage that radiation can trigger. The danger doesn't stop there. These scans often reveal harmless, incidental findings, tiny spots, scars from old infections, or benign cysts. They mean nothing, but once they appear on a report, they spark fear. Doctors feel pressured to investigate. Seniors feel terrified of what it might be. And suddenly, a healthy 68-year-old like Mrs. Carter from Ohio, who originally went in out of curiosity, finds herself scheduled for a biopsy she never needed. That biopsy leads to bleeding, then infection, then weeks of antibiotics, all because of a shadow that would never have harmed her. Too many older adults are pulled into this spiral, not because they are sick, but because the test created a problem that did not exist. National guidelines, including those used by leading hospitals, now warn against full-body CT scans for people without symptoms, especially adults over 60. They simply do not improve survival, and in many cases they create anxiety, unnecessary procedures, and physical risks that outweigh any potential benefit. If a doctor doesn't suspect something specific, the scan is not a shortcut to safety. It's a doorway to uncertainty. And unfortunately, this isn't the only common test that misleads seniors into thinking they're protecting their health. The next one is even more deceptive and far more personal for older men. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. Test number 2. Routine PSA, screening for men without high risk. For many men over 60, the PSA blood test has been presented as a simple, responsible way to stay ahead of prostate cancer. But thousands of experienced physicians in the U.S. now agree. For most seniors without symptoms or a strong family history, this test can quietly do more harm than good. PSA levels rise for many reasons: age, inflammation, even a recent bike ride. Yet, The number on the page rarely reflects true danger. Still, once that number looks high, the fear it creates is immediate and overwhelming. Doctors who have worked with older men for decades say they have seen this pattern far too often. A healthy 72-year-old like Mr. Holden from Arizona walks into a clinic feeling fine. His PSA test, done out of routine, not medical need, comes back slightly elevated. Within a week, he's sent for an MRI, then a biopsy. The biopsy triggers bleeding and severe urinary discomfort for days. Months later, he learns the truth. The cells they found were so slow growing, they would never have harmed him. But the emotional toll, the sleepless nights, and the fear of the word cancer stay with him long after the physical wounds heal. National guidelines now caution that for most seniors, routine PSA screening does not reduce the risk of dying from prostate cancer. Instead, it increases the chance of overtreatment, radiation, surgery, or hormone therapy. Interventions that can leave older men facing lifelong complications. Incontinence, erectile dysfunction, and chronic pelvic pain. These are heavy prices to pay for a cancer that may never have developed at all. The truth is painful but necessary. A test meant to protect can become the spark that turns a healthy man into a patient. And yet, this isn't the only screening that pushes seniors into unnecessary worry. There's another one, far more common, deceptively simple, and falsely reassuring, that many older adults take every single year without realizing the trap behind it. Test number 3. Routine vitamin D testing without a clear medical reason. Across the country, countless seniors walk into clinics every year believing a simple vitamin D test will unlock the secret to stronger bones, better immunity, and healthier aging. It sounds harmless. Just a blood draw, just a number. But many experienced physicians now warn that routine vitamin D screening in older adults, especially those without symptoms, quietly opens the door to fear, misdiagnosis, and overtreatment that can do far more harm than good. Vitamin D levels naturally fluctuate with the seasons, diet, and even the time of day. A single test can make a perfectly healthy 67-year-old appear deficient when, in reality, her level is completely normal for winter. Doctors who have treated seniors for decades know this all too well. They've watched patients spiral into anxiety over numbers that never needed to be checked in the first place. Take Mrs. Reyes from Colorado, a vibrant 70-year-old who loved gardening. Her annual physical included a vitamin D test, even though she had no symptoms and no history of bone issues. The number came back slightly below the lab's normal range, which often isn't even standardized across clinics. Panicked, she began taking high-dose supplements prescribed just in case. Within months, she developed nausea, constipation, and kidney discomfort, classic signs of vitamin D toxicity. The irony is painful. She wasn't deficient at all. She was harmed by an unnecessary test that pushed her into unnecessary treatment. National medical groups now caution that routine vitamin D testing rarely improves outcomes for seniors. It doesn't reduce fracture risk, doesn't predict future illness, and often distracts from the real issues that deserve attention: mobility, balance, nutrition, and muscle strength. For many older adults, low-dose supplementation and gentle outdoor activity provide the same benefit, without the emotional distress or medical risks created by excessive testing. But the most troubling truth is this: vitamin D screening isn't the only test that seems simple, yet places seniors on a dangerous path. There's another exam, more advanced, far more expensive, and wrapped in promises of early detection that can shake the confidence of even the strongest older adult. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. Test number 4. PET scans for Alzheimer's in seniors without symptoms. Among all the tests seniors fear most, few create more panic or more misunderstanding than the PET scan for Alzheimer's disease. It sounds powerful, almost magical, a way to see the future of your mind. But to the doctors who have spent decades treating older Americans, ordering this scan for someone without symptoms is one of the most misleading and emotionally damaging choices a senior can make. A PET scan can show amyloid deposits in the brain, yet these deposits are found in a large number of healthy adults over 65 who never develop dementia. Seeing them doesn't predict who will decline. It simply plants a seed of fear that can grow uncontrollably. Imagine someone like Mr. Patterson, a 70-year-old retired teacher from North Carolina. He felt perfectly fine, active, reading every day, walking 3 miles each morning. But after seeing an ad online, he asked his doctor for a PET scan just to be safe. The results mentioned mild amyloid accumulation, a phrase that means almost nothing on its own. But to him, it meant something terrifying. I'm losing my mind. Overnight, his confidence collapsed. He stopped driving long distances, stopped volunteering, and even avoided social gatherings because he feared people would notice something. Months later, a neurologist told him the truth. The scan did not mean he had Alzheimer's, nor that he would get it. But by then, the emotional damage was done. He had already begun living as if the disease had claimed him. Seasoned clinicians warn that this scan, when used on seniors without symptoms, leads to misdiagnosis, unnecessary medications, and life-changing anxiety. The mind is deeply sensitive to fear. When a person believes decline is inevitable, they may begin to withdraw, and that withdrawal itself increases the risk of cognitive decline. Instead of providing clarity, the PET scan often strips away the very thing seniors need most: peace of mind and a sense of control over their future. And yet, avoiding harmful tests is only half the story, because once we understand what not to do, the real question becomes, which tests actually protect your independence, your memory, and your heart as you age? Part 2. 4 most important tests after age 60 should. Test number 1. Abdominal aortic aneurysm, AAA ultrasound. For adults over 60, especially those who have ever smoked, few tests are as quietly life-saving as the AAA ultrasound. Unlike many screenings that create fear without offering real protection, this one reveals a danger that gives no warning at all: a silent ballooning of the main artery in the abdomen. Doctors with decades of trauma and vascular experience often say the same heartbreaking sentence: we usually discover an aneurysm for the first time when it ruptures. And by then, it's too late. The aorta carries the blood that keeps every organ alive. When it suddenly tears, the outcome is almost always catastrophic, especially in older adults whose bodies cannot recover as quickly. What makes this test so powerful is its simplicity. No radiation, no preparation, no discomfort. Just a quick, painless ultrasound that shows exactly whether the artery is strong or beginning to weaken. Seniors who take this test often tell a similar story. They walk into the clinic feeling perfectly fine and walk out realizing they just avoided a danger they never even knew existed. Take the case of Mr. Langston, a 73-year-old veteran from North Carolina. He felt healthy, stayed active, and only agreed to the ultrasound because his younger brother insisted. That scan revealed a widening in his aorta that could have ruptured at any moment. A planned repair saved his life. Without that ultrasound, his first symptom might have been his last. National health guidelines recommend a one-time AAA screening for older men who have smoked, and many physicians now extend this advice to seniors with a family history of aneurysms. The beauty of this test is that it gives you time to treat, time to plan, time to live without the shadow of a silent threat growing inside. And while protecting the aorta can literally mean the difference between life and sudden loss, there's another test that safeguards something just as important: the strength of your bones and your ability to stay independent as you age. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. Test number 2, bone density scan, DEXA. Among all the tests recommended for adults over 60, few protect long-term independence as powerfully as a bone density scan. Doctors who care for older Americans see the same heartbreaking pattern every year: a single fall, one unexpected fracture, and a senior who was once active and confident suddenly loses mobility, strength, and the ability to live freely. What many people don't realize is that bone loss creeps in silently. You can feel strong, walk well, climb stairs, yet your bones may already be thinning beneath the surface. A DEXA scan is the only way to see that danger early, before a simple misstep turns into months of pain, surgery, and rehabilitation. Experienced geriatric physicians emphasize that the risk becomes far more serious after 60. Hormonal changes, reduced vitamin D absorption, lower muscle mass, and decades of wear all work together to weaken bone structure. Without a scan, there is no warning. Mrs. Hall, a 69-year-old retired school teacher from Minnesota, discovered this the hard way. She slipped on her front porch and fractured her hip. Only later did her doctor tell her that a DEXA scan years earlier would have revealed severe bone thinning, a problem that could have been treated before the fracture stole her independence. She now tells every friend her age, "If I had known, I would have taken that test the moment I turned 65." The beauty of the DEXA scan is in its precision. It measures bone strength at exactly the spots where fractures are most devastating: the hip, spine, and wrists. With one short, painless test, seniors get a roadmap for protecting their future: medications when needed, targeted strength exercises, calcium-rich nutrition, vitamin D support, and fall prevention strategies that dramatically cut fracture risk. And yet, protecting your bones is only one piece of staying strong after 60. There's another screening, quick, simple, and often overlooked, that can detect early changes in memory before they become something far more serious. Test number 3, cognitive screening, a simple test to protect memory and independence. For many adults over 60, noticing small lapses in memory can feel frightening: forgetting a name, misplacing keys, or losing track of a conversation. Most seniors quietly wonder, is this normal aging or the start of something worse? That fear alone can chip away at confidence. What experienced neurologists and geriatric doctors want older Americans to know is that a short cognitive screening, just a few questions, a brief recall exercise, or a simple drawing task, is one of the most powerful tools to protect long-term brain health. It doesn't rely on machines or expensive imaging. Instead, it measures how your mind is functioning in real time, catching early changes long before they escalate into something more serious. What makes this screening so valuable is not just the test itself, but what it reveals. Early cognitive shifts often signal issues that can be treated: sleep apnea, depression, medication side effects, vitamin deficiencies, or high blood pressure damaging tiny blood vessels in the brain. doctors have seen countless seniors regain mental clarity after identifying these hidden causes. One moving example is Mrs. Donovan, a 74-year-old from Wisconsin. She felt her memory slipping and feared the worst. But her cognitive screening showed a pattern, consistent not with dementia, but with untreated sleep issues and poorly controlled blood pressure. With proper care, her memory improved and the cloud of fear lifted. She later said, "That little test gave me my life back." The beauty of cognitive screening is its timing. It catches problems while there is still a chance to strengthen the brain through lifestyle changes, medical treatment, and mental training. It empowers seniors rather than scaring them, offering clarity instead of confusion. And while understanding your brain's health is essential, there is another test, fast, precise, and trusted by cardiologists, that can reveal the hidden state of your heart long before symptoms ever appear. Test number 4, coronary artery calcium scan, CAC, the most powerful test to protect your heart after 60. For seniors across America, heart disease remains the single greatest threat to long-term independence. The tragedy is that most people never know danger is building until it's too late. That's why experienced cardiologists often refer to the coronary artery calcium scan as one of the most transformative tests an older adult can take. Instead of guessing whether plaque is forming in the arteries, the CAC scan shows the truth clearly, directly, and long before symptoms develop. It measures the hardened calcium deposits that silently accumulate in the heart's arteries, the very deposits responsible for heart attacks and sudden cardiac events in older adults. Unlike traditional cholesterol tests, which can be misleading or appear normal, a CAC scan reveals what is actually happening inside the arteries. Many doctors describe it as a wake-up call that can change the entire course of a senior's life. Consider Mr. Randall, a 71-year-old from Texas. He exercised regularly and believed his heart was strong. His cholesterol numbers looked good, so he never imagined he was at risk. But after his brother suffered a heart attack, his doctor recommended a CAC scan. The result shocked him, a high calcium score showing years of hidden plaque buildup. That single test led to life-saving interventions, medications, structured exercise, and a targeted lifestyle plan, which likely prevented a devastating event. The genius of the CAC scan lies in its simplicity. It's quick, painless, and uses a low dose of radiation, far less than most imaging tests. Yet the information it provides is priceless. It helps seniors and their doctors make decisions based on real risk, not assumptions. It can determine whether someone truly needs statins, aspirin therapy, or more aggressive prevention. Most importantly, it gives older adults the power to act before a crisis strikes. And once you understand how a single test can rewrite your future, the final step becomes even more important. Bringing every lesson together so you can stay strong, sharp, and independent for years to come. The right tests today shape the life you keep tomorrow. When you reach 60 and beyond, the choices you make about your health matter more than ever. Not because aging is something to fear, but because your body becomes less forgiving of the wrong turns, unnecessary radiation, misleading screenings, or tests that send you into a maze of worry with no real benefit. What truly protects you are the tests that reveal silent problems early, guide smart decisions, and help you stay strong enough to live the life you value. Walking without fear, remembering clearly, driving confidently, and enjoying every moment with the people you love. The truth is simple. Doing more tests does not mean better health. Doing the right tests does. Full body scans, Routine PSA checks, scattered vitamin D testing, and Alzheimer's PET scans often create confusion, false alarms, and painful interventions no senior should have to endure. But AAA ultrasounds, DEXA scans, cognitive screenings, and CAC scoring offer clarity, direction, and a real chance to prevent life-changing events. These are the screenings that protect your independence, the screenings that give you control in a world where so much of aging feels unpredictable. Think of your health like the foundation of a home you've lived in for decades. You don't tear down the walls looking for imaginary cracks. You check the places where time tends to cause real damage. You strengthen what matters most so the whole structure stays strong. That is exactly what these 4 essential tests do for your body. And now, the choice is in your hands. You can continue down the path many seniors unknowingly take, trusting tests that promise peace of mind but deliver anxiety and risk. Or you can choose a smarter path built on science, experience, and prevention. A path where every test you take moves you toward a longer, safer, and more independent life. Your future doesn't begin years from now. It begins the moment you choose the tests that truly protect it. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.